Okay, Russell, how's the order for my burgers coming?
Pretty good. Just a couple more minutes.
Great, thank you.
Behind you. A bit more.
A burn is an injury to skin and possibly underlying tissues caused by exposure to extreme heat, chemicals, or electrical contact. Common causes of thermal burns include direct contact with hot liquids, flames, or hot objects. Burns can also be caused by radiant heat from a hot environment or extended exposure to the sun. The severity of a burn is related to its depth and size. Deeper burns resulting in blistering or broken skin are more serious. Larger burns, even those with a shallow depth, are also more serious. Burn location contributes to severity. Burns involving the face, neck, hands, genitals, and feet can result in complications related to movement and other basic functions. Difficulty breathing as a result of inhaling hot air indicates a serious injury within the airway. All serious burns, or ones you are unsure about, should be evaluated by a healthcare provider. When a burn occurs, make sure the situation is safe for you to help. Act immediately to put the fire out. Direct a person to stop, drop, and roll. Smother the burning material with a coat, rug, or blanket. Or douse the material with water. Activate EMS if you think the burn is severe or you are unsure.
Can you call 911? Mike, get the first aid kit. I can help. Let's go cool this down some more.
Okay.
Carefully expose burned areas by removing clothing. If needed, cut or tear clothing away. If it is stuck to the burn, cut around it. Cool a burn with cool or cold water as quickly as possible. Cool the burn for at least 10 minutes. Use a clean, cool, or cold dressing as an alternative when water is not available. Never use ice or a frozen compress to cool a burn. There are also burn dressings pre-soaked with a specially formulated gel to promote cooling of the burn. Early cooling can reduce pain and minimize the risk and depth of burn injury. When cooling large burns, watch for signs of overcooling, such as shivering. Children have a larger surface area in relation to weight than adults and are more likely to have complications from overcooling. Remove any jewelry near the burned area. Separate fingers or toes with sterile dressings or pads. To improve healing, leave any blisters intact. Loosely cover the burn area with a dry, clean pad or clean sheet to help keep it clean and protected. Avoid natural burn remedies such as honey or potato peels. Never apply butter, ointment, lotion, or antiseptic to a serious burn. Give the person nothing to eat or drink. Keep the person calm and comfortable while awaiting EMS. Medical emergencies involving electricity can occur when there is direct contact with an energized object, such as an electrical wire or outlet, or when someone is struck by lightning.
Get us some help. May need the AED.
Be safe. If you cannot stop the flow of electricity, do not enter the area around the person or attempt to care for her. Turn off any electrical current before touching the person.
Off and locked out. It's okay to help now.
An electric shock can cause an abnormal heart rhythm in which the heart stops moving blood. When it is safe, perform CPR and use an AED if one is available. When a body part comes into contact with an exposed electrical source, electricity can travel from the point of contact to a second point of contact that is grounded. Common points of contact include the hands and feet. If the person affected is responsive and no longer in contact with the electrical source, look for burns at any suspected points of contact. Cool the burn as you would with a thermal burn. Cover with a clean, dry dressing. Consider seeking professional medical care because serious internal injuries can occur.
Oh, gosh. Great.
What happened?
Chemical spill, and it's starting to burn.
Some chemicals can damage skin tissue on contact.
Take it easy. Get it in there.
The priority is to carefully and quickly remove the chemical to minimize any damage. While preventing any additional exposure to the injured person or yourself, immediately flood the affected area with large amounts of cool water, unless the chemical is known to react with water. Safely remove any contaminated clothing while continuing to flush the area. Flush with cool water for at least 15 minutes or until the pain is relieved. Cover any visible burns loosely with a dry, clean pad and seek further medical attention. When dealing with dry chemicals, carefully brush off any dry powder with a gloved hand or cloth without creating further exposure prior to flushing. Corrosive chemicals splashed into an eye can quickly damage eye tissue. Affected eyes will become painful and appear red and watery.
Let me help, okay? We need to go rinse it out.
Immediately flood the eye with large amounts of water.
Keep your eye out. Keep your eye open.
Carefully hold the eye open and flush continuously for at least 15 minutes or until EMS personnel take over. Flush outward from the nose side of the affected eye to prevent contamination of an unaffected eye. If the person is wearing contact lenses and they are not removed by the flushing, have the person try to remove them as flushing continues. If running water is not available, normal saline or another commercial eye irrigating solution can be used. Chemical burns to the eye require professional medical care.
Brady, call EMS.
Activate EMS as quickly as possible. Without interrupting care, contact the Poison Helpline at 1-800-222-1222 for treatment advice when a chemical burn occurs. If not available, talk to the EMS dispatcher or a medical provider.